Good morning again. So today we'll go through malignant tumors of connective tissue origin. They are also known as sarcomas of the oral and maxillofacial region. So these tumors arise from mesenchymal tissues, and while rare compared to carcinomas, they tend to behave more aggressively and require careful diagnosis and treatment. So fun fact lang, with sarcomas, oh, they make up less than 1% of all head and neck malignancies. Pero when they show up sa jaws, madagu sila in both behavior and management. So, um, you think, huh, it is fast growing, destructive, bone expanding, and if if those three you would see on one case, you think of sarcoma until proven otherwise. So let's begin with fibrosarcoma. So you can think of fibrosarcoma as the malignant counterpart of your fibroma. So it is made of malignant fibroblasts producing collagen. It often appears as a deep-seated, slow-growing mass, but don't be fooled because yung fibrosarcoma nyo can be aggressive. So you have two main types, your primary and then your secondary fibrosarcoma. So this one is for your primary. It is a fibroblastic malignancy that produces variable amounts of collagen. And you would see it central, arising within the medullary canal, or peripheral, arising from the periostrum. Your secondary fibrosarcoma naman, it arises from a pre-existing lesion or after radiotherapy. So, secondary is more aggressive compared to primary and also has a poor prognosis. So, we have here the clinical features of your fibrosarcoma. The infantile form. The infantile fibrosarcoma actually has a great prognosis compared to your adult forms. So you also have for the bone and soft tissue, fibrosarcoma of the bone often present with pain and swelling after a long duration of symptoms. You also have their pathologic fracture. So um, some of the cases would have a previous history of bone infarct, irradiation, or other risk factors. For the soft tissue, it often presents as painless with shorter duration. So you have here the differential diagnosis. So what you have to remember with fibrosarcoma, no, scary, collagen, older adults, and metastasis risk. So yun, yung mga key points ninyo for fibrosarcoma. Also have here the different histologic features. You're well differentiated, you're intermediate grade with a herringbone pattern, high grade, and your sclerosing epithelial fibrosarcoma, which is an uncommon tumor of the soft tissues. So you have here for the treatment and prognosis, your surgery, your cancer therapy, chemo and radio, or combination. 5-year survival rate of 65%, the high-grade primary, less than 30, and secondary, less than 10% at 10 years. Next is your miscellaneous locally aggressive fibrous lesions, your nodular fasciitis, or your pseudosarcomatous fibromatosis. So this looks scary clinically because it grows fast, but it's reactive, not malignant. So a classic overactor tissue response. So you have here, please read the most common location and also the clinical, no, of your clinical appearance of your nodular fasciitis. So, rapid growth, short history, young patient, you consider nodular fasciitis, not always sarcoma. Okay? It is sometimes called your pseudosarcomatous or pseudosarcomatous fibromatosis because on biopsy, it can mimic malignancy. Hmm? Next is your aggressive fibromatosis or your desmoid tumor. So it is not malignant pero infiltrative and can destroy bone. So behavior-wise, kumbaga may attitude siya, 'di ba? So the key point would be no metastasis but very notorious for recurrence. So that is your aggressive fibromatosis or your extra-abdominal desmoid or your desmoid tumor. Please read na lang ha yung mga locations. Next is your proliferative myositis. So rapid growth, painful muscle lesion, still benign or reactive. Think of this as a muscle throwing a tantrum. Kumbaga. Next is your fibrous histiocytoma, fibrosantoma. So this is also a benign but malignant fibrous histiocytoma or MFH, now called your undifferentiated pleomorphic sarcoma. It is aggressive and tends to recur. Ang classic histopathologic pattern niya would be storiform or your cartwheel pattern, world or cartwheel pattern. Oh, it used to be the most common soft tissue sarcoma in adults. Your atypical fibrosantoma, which is a benign growth as well, closely related to your fibrosantoma. Does not occur in the oral cavity. Next is your desmoplastic fibroma of bone. So this is a lesion of bone, including the jaws. It does not metastasize with local recurrence. And this one, the location, most common location is on the mandible, especially, specifically the molar ramus angle area. And the treatment of choice would be surgery, excision, or curettage. For the clinical features, you would see it in skin of extremities. Oral and perioral lesions are uncommon. Pero, pagka it is seen inside the oral cavity, you would see it in the buccal mucosa and vestibule. Your fibrous histiocytomas, histological features, what you have to remember is the two-tone type, multinucleated giant cells, and the histologic pattern, which is storiform or crisscross pattern. Differential diagnosis, please read. Treatment and prognosis, like what I said earlier, no. Treatment of choice would still be surgery, no, excision. Malignant fibrous histiocytoma. The clinical features would be it is a malignant fibrosantoma, and OMS sites are seldom involved. So it occurs primarily in the soft tissues of the extremities and retroperitoneum. And the most common complaint of these patients would be moderately firm submucosal mass, expanding slowly or moderately fast, with or without pain, and surface ulceration. So it has a myxoid variant with a soft consistency and an angiomatoid variant, which is more superficial. Also have here your histologic feature, like what I said, cartwheel pattern, storiform pattern. Next is your synovial sarcoma, which comprises 8 to 10% of all sarcomas. It is rare in the head and neck area, but when it happens, it's usually in deep soft tissues near joints or tendon sheets. And it could also have a biphasic pattern histologically. So you have there the clinical features with male predilection. The most common site of involvement would be the region around the knee. So like what I said earlier, the head and neck area, very rare. Pero if it happens, in deep soft tissues, near joints or tendons. This one, spotty calcification or your snowstorm appearance, yan ang radiographic pattern or feature of your synovial sarcoma. And trivia lang, if there is calcification on imaging, it has a better prognosis. We also have here the histologic features. Sabi nga natin kanina, di ba? It could have a biphasic pattern histologically. Ayan. Heavy calcification, less aggressive lesion, more favorable prognosis. Treatment would be treatment would be wide resection with negative margins followed by localized irradiation. So remember that these are chemosensitive. Okay? Next is your liposarcoma. So malignant fat tumor. Kumbaga, this is a malignancy of fat cells. It's rare in the oral cavity, but most often on tongue. The myxoid subtype is the most common. So you also have here, yun nga, yung different categories. This one is the most common type. So you have here etiopathogenesis and the clinical features. Liposarcoma is the most common soft tissue sarcoma. Do not assume that every yellow mass is a lipoma like what you saw last time, di ba? Sa ating benign lesions. Because malignancy exists. Okay? And unlike your lipoma, your liposarcoma arises deep rather than submucosal. Okay? Also have here the different histologic features. Again, lipoblasts. Your myxoid, yan your round cell type. Please read ito. Plexiform pattern. Ito naman, vacuolated or granular cytoplasm. Your pleomorphic liposarcoma with extreme cellularity, mixture of bizarre, often multivacuolated lipoblasts, and atypical stromal cells. Treatment is surgery plus radiotherapy. Hemangioendothelioma. This one naman, so this sits between hemangioma and angiosarcoma in behavior. So you think of intermediate malignancy. Okay? So this one is proliferative and neoplastic vascular lesion between benign hemangioma and your malignant angiosarcoma. So please read on the different associations. The clinical features, more common in females with swelling and pain. Also, the most common location would be on the skin and the subcutaneous tissue. Histologic features, your solid sheets of epithelioid with epithelioid hemangioendothelioma and spindle shaped if it is the spindle cell hemangioendothelioma. Treatment and prognosis, wide surgical excision, almost one-third of epithelioid hemangioendotheliomas develop metastasis to regional lymph nodes, the lungs, liver, or bones. Next is your hemangiopericytoma. This is a neoplasm which is usually benign but has a definite malignant counterpart. So these are derived from pericytes around capillaries and may show the classic staghorn. Yan. Your staghorn vessels or the staghorn pattern. Okay? Yeah, the infantile type naman, it rarely metastasizes. Differential diagnosis and the treatment, surgery. Next is your Kaposi sarcoma. So this one is a vascular malignancy associated with HHV8 in the oral cavity, commonly on the palate and on the gingiva. So you have there idiopathic multiple pigmented sarcoma of the skin. So key clinical clue would be purple, red patches or nodules, especially in immunocompromised patients. So you have there the clinical features, you have the clinical presentations, the classic, the endemic, the immunosuppression associated, and the AIDS related. The classic variant, your lymphadenopathic Kaposi sarcoma, transplantation associated, and your AIDS related. Please read it. Histologic features, the early lesions, your patch stage. Advanced lesions naman are your plaque stage and the nodular stage. Treatment and prognosis, surgery, low dose irradiation, intralesional chemotherapy, sclerosing solutions, and systemic chemo. Next is your Ewing sarcoma or your endothelial myeloma or your round cell sarcoma. So your Ewing sarcoma, yan, Ewing's bone peanut soft tissues or your primitive neuroectodermal tumor. So for the Ewing sarcoma, they are highly malignant, small round cell tumor, and jaw involvement shows rapid swelling and sometimes onion skin periosteal reaction. Onion skin. Okay. So what you have to remember with your Ewing sarcoma, saan ba yan? Ayan, onion skin, would be EWS FL1, FLI1 gene plus onion skin. So EWS dash FL1, no, FLI1 gene plus onion skin. Okay? So you would also see sa radiograph naman the osteophyte formation similar to the sunray appearance of your osteosarcoma. Histologic features, your solid sheets or masses of small round cells. Tatandaan nyo yung round cells sa kanila. Okay? Your sarcoma cells, filigree pattern. Ito yun, ito yung sinasabi ko. EWS, FLI1 gene plus onion skin equals your Ewing's sarcoma. Differentials in the treatment and prognosis, they are radiosensitive. The treatment of choice would be radical surgical excision. Next is your chondrosarcoma. So this one is a malignant cartilage tumor. It's rare in jaws but dangerous when it occurs. So you have here myxoid chondrosarcomas or dedifferentiated chondrosarcomas. No? The clinical features, it occurs at any age between 10 and 80 years. So very broad yung age range niya. Okay? With a male predilection, high-grade, fast-growing tumor with excruciating pain. You have here the different variants or the different types of your chondrosarcoma. Ayan, ito pala siya. So for mesenchymal chondrosarcoma, it occurs between the ages of 10 and 30 with equal gender distribution, and the location would be the jaws and the ribs. For your clear cell chondrosarcoma with a slow growth pattern and a much more favorable clinical course with very low metastatic potential and high probability of cure. Itong variant or type na to could occur in the mandible, maxilla and the mandible. Your dedifferentiated chondrosarcoma, which is the most malignant form of your chondrosarcoma. So the oral manifestations, painless, mucosa is often intact. So ang tatandaan for chondrosarcoma would be tooth loosening without periodontal disease. You always think of malignancy. Ayan, may resorption, exfoliation. Okay. Radiographic features, you have radiopaque lesions, calcification of the neoplastic cartilage. And your histologic features. Also have here for the secondary chondrosarcoma, your mesenchymal chondrosarcoma, clear cell, so your giant cells and tumor cells. And then dead differentiated mix of low-grade chondrosarcoma and high-grade spindle cell sarcoma. Grading, so we have this we base on the cellularity of the neoplasm and the cytologic atypia. So we have grade 1, grade 2, grade 3. Treatment and prognosis, surgery, wide excision, X-ray radiation, and chemotherapy of little benefit. Like what I said yung kanina, the most malignant form of your chondrosarcoma is your dead differentiated chondrosarcoma. Ang survival rate niya is only 10%. Next is your osteosarcoma or your osteogenic sarcoma. This is the third third most common cancer in adolescents. So it arises from primitive mesenchymal bone-forming cell and is characterized by production of osteoid. So for the clinical features, your osteosarcoma is a malignant bone-forming tumor. So you may look clinical and also radiographic. You may look for sunburst pattern, widened PDL, Codman's triangle in the imaging, and your jaw osteosarcoma tends to present a decade later than your long bone cases. Okay, so you have here, it could occur in any bone, most common with long bones of the extremities. Most common sites, please read sa skull and jaw, 8%. Etiology, the exact cause is unknown. Predisposition, rapid bone growth, genetic predisposition as well. You have different variants of your osteosarcoma. You have the multifocal synchronous, telangiectatic, small cell, intraosseous well differentiated, and intracortical, periosteal, paraosteal, and high-grade surface. So clinical features again, swelling and pain of the involved bone. The patients complain of sprain, arthritis, or not growing pain. Bakit ganito? Your systemic complications, fever and night sweats are very rare with the history of trauma and osteomyelitis. Oral manifestation, swelling, facial deformity, pain, loose teeth, paresthesia, toothache, bleeding, nasal obstruction. So it develops with considerable frequency in bone affected by osteitis deformans or your Paget's disease. This one we would talk about in the finals. So your Paget's disease increases osteosarcoma risk dramatically. So for the radiographic features, you have their little tumor bone radiolucent, much tumor, radiodense. Mix, intermediate degree. Okay? So cumulus cloud densities form within the intramedullary and soft tissue components. Three classic features, your sun ray pattern, resorption of the adjacent bone, resulting in uniform widening of the space, and the Codman's triangle. So yan yung three classic features of osteosarcoma na nabanggit ko na kanina, 'di ba? Sunburst pattern, widened PDL, and the Codman's triangle in imaging. So your Codman's triangle is an acute angle between the bone surface and the periosteum. Histologic features, white to tan, yellow in color, and firm in consistency. Hemorrhage and necrosis are common. You have also stages or your staging, stage 1, 2, 3, substages A, B, and the site, distal extremity, distal femur, and the axial skeleton with the worst prognosis. Treatment, amputation if needed, radical resection, neoadjuvant chemotherapy. Ang metastasis niya would be on the lung area. Next is your malignant lymphoma. So these are a group of neoplasms of varying degrees of malignancy, which are derived from basic cells of lymphoid tissue, the lymphocytes and histiocytes in any of their developmental stages. So accounts, your non-Hodgkin's lymphoma accounts for approximately 70% of all new cases of malignant lymphoma. Classifications, kasi we talk of Hodgkin's and, Hodgkin's muna. Your Hodgkin's, so these are non-Hodgkin's, these are lymphoid malignancies, but included here because jaws could be involved. So your non-Hodgkin's lymphoma often presents with jaw swelling, loose teeth, non-healing extraction sites. Yung inyong Hodgkin's naman has the iconic Reed-Sternberg cell. Ang Burkitt's lymphoma nyo naman, yun yung may starry sky pattern. Non-Hodgkin's lymphoma. You have the nodular pattern and the diffuse pattern for the histopath. Treatment, radio, chemo, with two prognostic groups, the indolent with a good prognosis, not curable in advanced stages, and the aggressive, shorter, can be cured with intensive combination chemotherapy regimens. Your primary lymphoma of bone, this is a rare malignant neoplastic disorder of the skeleton, with 94% primary lymphoma of bone cases result from non-Hodgkin's lymphoma, and 6% naman resulted from Hodgkin's disease. So the clinical features would be number one, pain. Sakit siya, and also there would be palpable swelling of or mass and pathologic fracture with functional deficits. So you have here, uh, uh, this was taken sa inyong reference book. Sa reference. Your Burkitt's lymphoma. So this one occurs sporadically throughout the world. So you have high-grade B-cell neoplasm and has two major forms, your endemic, the African form, and the non-endemic or the sporadic form. So for the African form, you would see it in the maxilla or mandible, with the swelling and loosening of teeth and also swelling of the lymph nodes. Abdominal presentation is slightly less common. Yun yung sa inyong sporadic form that targets abdominal organ. So, abdominal tumors causing swelling and pain in the affected area with symptoms of bowel obstruction. So, for the clinical features, you have their metabolic derangement and renal function impairment. The major signs, soft tissue mass associated with involvement of the jaw or other facial bones, enlarged cervical lymph nodes, abdominal masses, and ascites. So you have here, like what I said earlier, your Burkitt's lymphoma. Your Burkitt's lymphoma has the starry sky appearance or the starry sky pattern. Treatment and prognosis, combination chemotherapy, and CNS prophylaxis. Next is your Hodgkin's disease. Ang Hodgkin's ninyo, considered as one of the two main types of malignant lymphomas, associated with EBV, HIV. HD is not considered as, your Hodgkin's disease is not considered an AIDS-defining neoplasm. So, ang clinical features, more common in males. First manifestation would be enlargement of your lymph nodes. Yan. Paki-remember. Cervical area, axilla, inguinal area, Waldeyr's ring, or occipital nodes. You also have constitutional symptoms like unexplained weight loss, fever, night sweats, chest pain, cough, SOB, alcohol-induced pain at sites of nodal disease, pruritus, or intermittent fever. You have nodular sclerosis, Hodgkin's disease, with a nodular pattern. So, nodules, yung mga tatandaan. So, you have here the characteristic cell is your lacunar type RS or the Reed-Sternberg cell. Next is your mixed cellularity HD, so 15 to 30%. Diffuse infiltrate, your Reed-Sternberg, are classic type and affects the abdominal lymph nodes and spleen. Next is your lymphocyte depleted HD. So, infiltrate is diffuse and appears hypocellular and is associated with older age and positive HIV. Your lymphocyte-rich classic HD, 5%. So, the RS or Reed-Sternberg cells are of the classic or lacunar type with the background infiltrate of your lymphocytes. Nodular lymphocyte predominant HD, you would see popcorn cells. Please take note of this one, popcorn cells. So proper treatment of Hodgkin's disease can lead to long-term remission and even cure. So the treatment would be radiotherapy, radiation therapy, and then combination chemotherapy. Yeah, that's it. So to wrap up lang, your connective tissue malignancies in the oral cavity, they are rare but aggressive. So fast growth, jaw expansion, 'di ba? pain, mobility of teeth, radiographic changes should always raise suspicion. Diagnosis also requires biopsy with clinical and radiographic or radiologic correlation, and early recognition changes prognosis significantly. And as future clinicians, as future dentists, our job is not just to spot lesions, but to understand their behavior. Because the earlier we suspect, the earlier we save. Thank you.